Hi, today we're talking with Dr. Tom from Natronet. Our topic today is BPH. Now, this is something that's typically associated with older men like our grandfathers. So is that true? And what exactly is BPH?
Benign prostatic hypertrophy is for all intents and purposes, is part of the aging process where the prostate gland, we'll say, is swollen, and as a result of that, will produce a variety of different types of symptoms. We generally associate it with older men, over 50 or even over 60. And, depending on the amount of swelling that typically happens, the man may have, different types of urinary symptoms. For some men, it's really not an issue at all, and except perhaps they have to get up during the night to urinate several times. So it can certainly affect their sleep patterns, which can affect their energy the next day. And in those cases, it definitely becomes a problem. But sometimes you'll have urgency, sometimes there's the frequency, sometimes there's difficulty starting, there's dribbling afterwards. So it's more of an inconvenient type of a symptom than a real problem. Many men, unfortunately, will also suffer from prostate cancer, which is the most common type of cancer that men get. And sometimes there's an overlap of, do I have BPH or is there prostate cancer involved? So, it's important that that evaluation be done. And there's a number of ways to be able to manage BPH. There's obviously medications, but there's also herbal medicines. There's different types of exercises that can be done to support that also. So we look at not just the prostate gland, but the whole pelvic area. We look at the diet again. That's critically important. We look at which fluids a person is drinking and how things are being processed. And so, if your granddad is 80 years old, it's almost for sure that he has some degree of BPH, and any man just sort of learn to live with it. As I said, if it doesn't affect their sleep quality as far as their energy is concerned the next day, they say, it's just part of what I do, so we're fine.
Okay, great. Thanks, Dr. Tom.
You're welcome.